Only on Fox, an emotionally charged subject involving babies. A decision for doctors and families to make. Keith Yaskin on a very hot but very private debate.
Well, it's been wonderful. It's been a blessing.
The colors of a baby boy now share space with his sister in a second-story room. It is perfectly dressed up for the family's newest addition.
For the topic, that we're discussing today, we prefer to protect the identity of our son.
Mom and Dad say they have nothing to hide. It's just the sensitivity of the subject at hand. Like a growing number of parents, they chose not to circumcise their son. It used to be in the United States, more than 80 to 90% of parents would circumcise their sons. But the latest figures show that number is down to 50 to 60%. Babies are strapped into this and often injected with a local anesthetic, which doctors I talked with say make it virtually painless. But the American Academy of Pediatrics states circumcision doesn't need to be a routine procedure. This mom wrote a report in college about the topic and feels highly educated about the debate of whether to cut or not to cut.
God creates, our bodies with purposes, and I don't think that he would make a mistake on 50% of the population.
Critics of circumcision, with their websites and ads, speak with great passion about their position. Talk with them and you hear about a medically unnecessary procedure that robs a child of his right to make his own decision later in life about his body.
Ideologically, I don't think a parent should be able to cut off their child's anything.
Doctors I talked with argue circumcision involves little risk and perhaps most importantly, may help prevent the spread of sexually transmitted diseases such as HIV. Board-certified dermatologist Dr. Charles Crutchfield III says circumcision peaked in the 1980s when more than 80% of men were circumcised. But now insurance companies are not paying for it in hospitals as much as they used to.
I have never met a patient who told me they were very upset that they were circumcised. But I've met several patients in my career who were upset that they were not circumcised.
He's worked with men who are not circumcised and suffered problems such as various infections and cancer.
This is not the solution to preventing sexually transmitted diseases. But once again, when you're fighting a big war, you want to use all the tools in your toolbox, and this is one tool. So that's another consideration.
I haven't read anything that's been conclusive enough for me to make me believe anything different than I do.
Two of the biggest discussions are not medical at all. Religious tradition and looking different in both the locker room and to a partner used to seeing something different.
There's certainly a social consideration. I remember growing up myself, we had one of my classmates was uncircumcised. I remember he was teased in the locker room. I saw him later, he was crying.
Dad is circumcised, but says a woman who judges his son for being different is the wrong woman.
It implies to me a shallow relationship.
And I doubt that she would judge him, on that if she really loves who he is.
In nurseries full of color, certainly, the answer is not black or white. Keith Yaskin, Fox 10 News.
What an interesting debate. So what's the opinion of a doctor who was on the task force on circumcision? We'll check out his interview with Keith at myfoxphoenix.com.